Welcome, David and Avrum. Thank you so much for being here today. I'm going to let you guys introduce yourselves.
Hi, I'm David Konigsberg, and I have a practice in Midland Park, New Jersey.
Hi, I am Avrum Joffe. I am also a pediatric orthopedic surgeon in Ridgewood, New Jersey.
Dr. Konigsberg and Dr. Joffe are the pediatric orthopedic surgeons that are part of our interdisciplinary spasticity clinic at Valley Hospital. And we have some questions from the community for them. Our first question is, how does cerebral palsy affect the musculoskeletal system, specifically the bones and joints?
The overactive muscles and tendons can produce contractures of the joints, and that's where we come in, and we try to sometimes straighten out a bent joint or bend a straight joint.
Also, these contractures can lead to pain over time as it throws the joints into an unpleasant orientation. It can lead to secondary bone deformities. It can cause the bones to migrate away from their normal position, which can cause arthritic pain, actually, even in a young child.
What are some orthopedic surgery interventions that can help patients with spasticity?
I think one of the great things about doing pediatric orthopedic surgery in this setting is we have such a wide range of options. Very often we'll work with the team, try to work on a tight tendon or a tight muscle and assist them just by simply putting on a cast. Sometimes that helps. So for example, Dr. D'Alessandro, I know that you're very good at doing the Botox, and then we'll put on a cast afterwards to try to help that patient lock in that position. And then sometimes it's more severe than that, and we actually have to do some tendon lengthening operations when conservative treatment doesn't work.
And if there's secondary bone deformity from the chronic contracture of that particular joint or extremity, we can even go as far as to perform an osteotomy, which is when you make a correction of the bone physically and put it back together in a proper orientation or a more functional orientation for that patient.
Next question is, what do you like about the interdisciplinary approach of our spasticity team at Valley? What are some of our strengths?
I think some of our strengths are recognizing what our weaknesses are. There's many times in our clinic where our physical therapy team, our neurologist, our physiatrist or neurosurgeon will notice something that I'm not noticing. And I think when we have so many people looking at the same patient from different angles, I think we work much better together. And the same extends into the operating room. A lot of times we'll do combined procedures with neurosurgery, and some of our most effective procedures that we do are actually combined approaches where we have two orthopedic surgeons working on the same person, and it makes it more efficient, and most importantly, we have each other to judge whether a position is right or the right operation is being done.
Yeah, the team approach has been really beneficial for these patients because we can also tailor our procedures that David and I often do together to meet the patient's needs. Maybe it's to help the patient stand more comfortably or sit more comfortably. But if we have the team approach with our therapist, our neurosurgeon, our neurologist, our physiatrist, we can really meet that patient's specific needs more accurately.
Thank you both for coming here today. We really appreciate it. And how would our patients find you if they wanted to get in touch?
They can look up both of our names and numbers at the Valley website, and they can direct you to our office staffs.
Thank you.